and what are the medical treatments for arthritis, and what is the nutrition intervention. In other words, you intercept it and you stop it from getting worse, and you reverse it and bring it back to normal, where you no longer have the joints, the swelling has gone down, and you have movement in your joints, and there's no pain. So if that is something you're looking for and you want to find a way, because in whatever you've tried medically has not changed anything, stay with me and I will take you through it and give you answers, so that by the end of it you'll know what you need to do to remove that pain and get your joints working again and take away the swelling. So what happens in arthritis? So what I've done here, I've done a diagram of a bone, and around the bone in the blue here is the cartilage. There's cartilage here which protects the bones, so that the bones here do not touch. The bones mustn't touch. So this is like a protective layer, and it eases friction and it lubricates it. And here is the tendons also, which is also cartilage. So that helps to keep the bones together. Now what happens with arthritis? Normally arthritis is actually stress related. What is meant by stress related is when you're under stress, it's something that one can't take away, there's always stress. But how do you respond to stress is what is the problem. If your body is unable to respond to the stress because it doesn't have the nutrients that is needed for handling the stress, then you'll have arthritis that will set in, and I will explain how that happens. So what stress does, it demineralizes the bone. Demineralize means calcium from the bone is removed. So when calcium is removed, calcium is a mineral, is removed, the bones become porous. So you start getting the onset of osteoporosis because calcium is leaving the bones. Stress does that. Now, what happens with the calcium is that the calcium comes and deposits itself into the tissues here, the soft tissues. It deposits itself in the protective tissues and it starts hardening them. So this is where the problems are starting. So when that happens, there's some form of damage that happens in the cartilage, and the cartilage gets broken down and swelling starts to happen. So then you get the swelling and the deformity. So the deformity that you have is actually the calcium depositing there in those soft tissues. So it's like building up. It's like you're building up bone in the tissues, which should never happen because the tissues is to prevent the friction. So where does this happen? Normally the joints will be in the fingers, the spine, the hips, the knees, lower back. You get these pains. What can also happen? It degenerates in your back. It degenerates your discs. So if your discs, which are made of cartilage, starts degenerating, then the bones in the discs start touching, and that's a very painful thing. So when it's touching, and in the back, in your spine, you'll have nerve channels. So the nerves start touching. So that becomes a very, very painful thing that happens. And what is the handling is you take painkillers. So basically, because I went to look for what are medical treatments. Medical treatment says there's no cure. And what do? They give you anti-inflammatories like ibuprofen. What is it for? Is to reduce the pain, to reduce the stiffness, to reduce the swelling. So basically, it's not fixing anything. So as the stress continues, as the calcium goes out, as the calcium keeps getting into the soft tissues, it just gets worse and worse and worse. So the medical treatment is actually not doing anything about it. It's just trying to ease the pain. It's trying to make you less painful. And it's also saying that it's trying to slow it down. So in other words, it's going to progress, but the medical thing is to slow it down. So now, by you listening to this, I guess you are listening to this because you want to find a way that you don't need to slow it down. You want to turn it around. And this is what I'm going to show you now. So how do you use nutrition now to reverse this? So there's a few steps that you have to approach there. First of all, you have to handle the stress. So you can't change the stress, but what you can change is you can change the foods that you eat so that the body responds to the stress. Because what happens in stress, it demineralizes the bones lose calcium, it actually causes muscle atrophy, your muscles get broken down so that it converts it into sugar. The reason it converts it into sugar because it's a mechanism for flight and fight. So if you want to run away or fight, the body thinks that you're fighting something, so it responds to that. So it breaks down your muscles in your arms, in your legs, and turns it into fat, and you start getting fat bellies, fat starts hanging here, and your legs get thinner. So you need stress foods. There's certain nutrients that you need to handle the stress, which I will explain what is needed. Secondly, one of the reasons calcium gets lost is because there's a lack of magnesium and there's a lack of vitamin E. When there's no vitamin E, the increase in calcium is 500 times more and enters into those tissues. So when there's the presence of vitamin E, there's much less calcium coming into the tissues, or actually calcium should not even be going into the tissues. And in the presence of magnesium, magnesium prevents the calcium deposits in the soft tissues. So in the presence of magnesium, there's no calcium going in, and in the presence of vitamin E, when there's no magnesium, there's less going in. So those two have to be present. So no magnesium, no vitamin E, you get osteoarthritis. So I spoke about arthritis. Osteoarthritis is when this is damaged. So in other words, the bones are getting damaged now and the tissues are getting damaged as well, because there's a lack of magnesium and a lack of vitamin E. And also you need vitamin D. Vitamin D, which is the sunshine vitamin, so go and get a dose of sunshine very often on your skin so that it produces vitamin D, or take supplements of vitamin D, because what vitamin D does, it reabsorbs calcium in the kidneys. So if you don't have vitamin D, your body loses calcium. So when there's calcium being lost from your bones, you get osteoporosis and all these problems happen. And when calcium is lost in the kidneys, you can get kidney stones. So you need vitamin D to prevent the calcium from getting lost. And with magnesium, the calcium is utilized properly, because calcium and magnesium is actually used for the nervous system. Calcium and magnesium is used for the muscles, for muscle function, for muscle contracting and relaxing. So this is where calcium and magnesium is needed. But if it goes into the tissues, then it does a different job, which is where you're having that problem. So calcium magnesium, you must get it in a CalMag formula. Calcium magnesium mixed together in an ascorbic acid mixture, or apple cider vinegar in an acid thing, so that it dissolves the calcium magnesium, so it's absorbable and available immediately in your blood. Calcium magnesium also is very good for, as I said, for the nervous system. It actually helps with relaxing, it helps with sleeping as well. So if you find yourself having all the sleep problems and all that, it's because of that. All the stiffness that you're experiencing, numbness and tingling, is because of the lack of calcium, lack of the magnesium present with the calcium. Now, so how do you rebuild cartilage? So these are the nutrition things to do. So I spoke about stress. So now that you've handled the stress, so that the muscles don't get broken into, because with the stress vitamins, which I'm going to give you just now, so we were speaking about what destroys the cartilage here, was vitamin E and magnesium. Sorry, I didn't talk about stress, but I did mention about stress. So we need to remove calcium buildup, which we said with magnesium and vitamin E. How do you, to reduce inflammations, because inflammation is due from stress. Stress depletes certain vitamins, which actually creates inflammation. How to restore calcium back to the bones. This is with the stress formula. And how to reverse osteoporosis. So, an anti-stress. So the anti-stress formula is also produces anti-inflammatory hormones. The anti-stress is vitamin C 2000 milligrams, B5 500 milligrams, B complex 25 milligrams, omega-3 2000 to 4000 milligrams, vitamin E 400 to 800 international units, and you must have protein as well with digestive enzymes, because under stress there's not enough digestion happening. So when you're taking protein, take it with digestive enzymes just for a short while. And this regimen here, this is called the anti-stress formula, should be done for 2 to 3 days, about 3 times a day in acute cases. So 2 to 3 times a day, 3 times a day you do this. I'm going to give you links on this formulation, so you can read on it and you can apply it. Or what you can also do, if you need advice and guidance, you can ask me and I will give you guidance on it. This is just to let you know these are the things that you can do. I've got links on arthritis, I've got links on adrenal glands, because adrenal glands is what creates the anti-inflammatory hormones. Links on junk foods, vitamin E, what it does, omega-3, what omega-3 does. These are links so that you can get more information if you're interested to know more about it. So, how do you rebuild cartilage? So now that the cartilage has been damaged now, what you need to do before you can rebuild cartilage, you have to have the anti-inflammatory. You need to reduce the inflammation. So what happens when you put the anti-inflammatory hormones, which is produced by this, when we're doing the stress formula, the stress formula will also create the anti-inflammatory. The anti-inflammatory now will create a shield. It will shield this area. This area is now protected now. So any junk foods will not come in. Any toxins will not come in, because the junk foods and toxins and the calcium has been destroying all of this here. So this is now, it puts a stop on there. Any viruses that can come here, or bacteria that can come and eat up all this, that protection now has happened with the anti-inflammatory, which is done naturally by the body when you do this formula. So that's the reason for the formula, is to first produce these anti-inflammatory. So now that this is protected, now reconstruction can happen. So how do you do reconstruction now? The reconstruction is done with three products, which rebuilds cartilage. So it's called glucosamine, chondroitin, and turmeric. Turmeric is an antioxidant. It helps with the acceleration of the process. So now you put in glucosamine and chondroitin. These are the building blocks to rebuild your cartilage. So now you're rebuilding this here now. It's been damaged, you're rebuilding this. It removes the calcium out, rebuilds that. The anti-stress formula does that to help remove the calcium. The magnesium helps to remove the calcium. So the calcium goes and does its job. What did I say? The calcium's job is for the muscles, is for the nervous system, to calm the nervous system, for the muscles to move so that you don't have muscle cramps. Because that's what happens when you have muscle cramps, there's a lack of calcium, and the calcium-magnesium balance has gone out. So now you're rebuilding this here while you are protecting the area, while this anti-stress formula is doing this. So that's how you reverse the arthritis. I've had results out of it. I had somebody who was a golfer. He could not move his fingers. He loved playing golf, and he had lost hope. And when he came across this formula and he applied it, next thing his fingers started moving. The pain started reducing, because all this is being rebuilt. The anti-inflammatory is taking the pain away, taking away all these junk things that are destroying it, and he got back to playing golf. So if you're experiencing any of these problems with your joints, somebody else that I helped with discs, his discs were getting damaged. They were going to put him on stretching his body if they wanted to operate for him. But when he did this formula and taking it with glucosamine and chondroitin, the pain disappears. So basically what's happening is there's a reconstruction that happens. If he's under stress, it just gets worse. So when the stress comes, you just top up on this thing. As I said, stress, you can't take stress away. There will always be stress coming. So if it flares up, this is your answer. All right. So I think that's all I can say right now. Yeah, I've covered everything. And so now, if you've experienced arthritis, apply this, talk to me. I can give you guidance on how to do it, because your foods also, your junk foods also has contributed to that. So you need to know what are junk foods. So do some reading as well, and that will explain to you so that you can do this. If you know somebody who's suffering with this and wants to convert and change the situation from slowing it down to reversing it, please share this video so that they also get the benefit of what I've been explaining to you. And thank you for listening, and I trust to hear from you and hear your results and your successes.